Hello and welcome to the Young Tongues podcast. My name is Barbara Fountain and I am the founder of this and CEO of the Young Tongues, a peer-to-peer support group for young tongue cancer patients around the globe. And we are back from our summer break and I am so delighted to bring you another patient story and a lovely, lovely human called Candi Holly. Candi, welcome to the Young Tongues podcast. Now, we love to get to know our fellow friends beyond the cancer diagnosis. So, can you introduce yourself to the community? Like, who's Candi?
Okay. I am a wife and a mother. I have four wonderful boys, three of them that still live at home. They're teenagers now. And I started off after leaving school as a nurse, and I did my training in South Africa. And then I immigrated to the UK and decided I didn't really feel like nursing anymore. And so I did lots of different things, including joining the Metropolitan Police. So I was a police constable for a while. But then when I was about 30, I got together with a wonderful man and we got married, and I fell pregnant on honeymoon. And I had to leave the police after that. And I've been a mum for think I decided I'd go back to work when my eldest was about 12 or 13. Well, my youngest that's at home. And so, of course, it's really hard to get back into all of that. And we also live in one of the most remote places in the UK called Bude in Cornwall. So everything is an hour away.
Oh,
First
wow.
train, hospitals, everything is over an hour away, including KFC. So it's very difficult. So yeah, I knew that. I knew going back to work would be difficult. And I did a few little things. But then I got a position as a social prescriber, which, it's quite a new role within the last 5 years. The government have brought them in. Absolutely loving my job. Um, yeah, was in it for almost a year before I was diagnosed. So I thought I couldn't be happier. We live by the beach. We spend our time very busy outside, and so that was me before all this
Yeah. So,
started. Yeah.
just a question, just for those that don't know, what is a social subscriber? Or
So it was something the government brought in to try and help relieve doctors and GP practices of all the social issues that they often have to deal with. GPs have a 5-minute consultation with a patient, whereas a social prescriber gets an hour on their first session. And then we try and work with people, and we deal with anything from, struggling with debts, social isolation. I also work in the community, getting groups, helping to facilitate support groups going. Yeah,
amazing.
just everything else.
I can see how your walk of life, that was like the perfect role, having
Yeah,
been in nursing and policing and all that life experience of being a mother as well. So yeah, so it's
yeah,
all going great. You're in
yeah,
Cornwall, in the most beautiful part of the world, let's be honest.
yeah.
And then, so when did you realize that something wasn't right?
Well, it was a bit of a long way to get there, but I went to the dentist in 2022. I hadn't been through COVID, just never got a chance to go. And the first thing my amazing dentist said was, "There's something in the back of your mouth, on your tongue." I was like, "Really?" So she said, I'm just going to get you a referral. I'd rather have no than not no. And I have spent many years suffering with lichen planus,
Hmm.
which, it goes on your cheek or on your tongue. I had it on my cheek for a while, but it went away. Never ever caused me any problems. No idea what causes it. So I don't do any of the things that supposed to cause it. Yeah, but I do have a stressful life. I'm busy with work and with my kids, and I know that I'm a busy person, so stress is probably a big part of it. So anyway, 2 weeks later, I go to the to the hospital, and they go, okay, it looks like lichen planus, but let's just do a biopsy. So I had the biopsy in August of 2022, and when I went to see the consultant, I didn't see the head consultant. I saw one of the other doctors, and he said, "It's all fine. It's nothing to worry about. Let's." He actually said, "You can go back to your dentist, and I won't see you again." But then I had a call a month later, and the main consultant, Andrew McLennan, an amazing, amazing man, who said he'd rather I came back to see him and not just leave it. So they were basically watching me. I had been again, and I said, "You know what? It's really sore now." And
Mm.
the other um, doctor I saw went, "Oh, I think you've triggered it, and that's what's causing the pain. So I'll give you some steroid to put on it." So it just didn't go away. It just the pain. Eventually, I couldn't eat. I could feel it all in the back of my mouth. And so in December last year, I had an appointment to see Andrew McLennan, and he looked and he went, "That's offending me. I don't like
Mm.
what's in your mouth." And it was like a little, there was something else there. And my husband had said to me, "Your breath's starting to smell. You must tell them." So I was like, okay, fine. So I don't actually have a sense of smell. I lost it when I had my first child. So I thought, oh, okay, well, um, and we were planning on going away to Scotland for a holiday, and Andrew McLennan said, "I need to do this biopsy before you go anywhere." So they did that. And yeah, on the 19th of December last year, he phoned me while I was on top of a mountain in Glenshee and said, "I'm really sorry, but you've got squamous cell carcinoma in your mouth. So as soon as Christmas is over, we're going to get you in and see what we can do."
Mm.
So, chest and MRI of my mouth, which showed absolutely nothing. The
Wow.
only thing the MRI showed was a swollen lymph gland. So, yeah, that
That's
was
amazing.
the
So
diagnosis.
I was just gonna ask some
Mm.
more questions.
Yeah,
So it's right at the back of your tongue,
it's at the back on the
on the
side. So it's
side.
not right. And it was also sort of, I could see it was going like it was growing onto the back of my throat, that section
Yes,
where your wisdoms are, like back there.
back
Yeah.
there. I mean, okay. And then the other thing that just came to my mind as well. So you live in Cornwall. Where do you go for the? I mean, you have probably a local-ish dentist, but beyond that, it must
Mm.
be a huge travel to get to the specialists.
I tell you what, Barbara, dentists are like they are precious here. Because my mum moved here from South Africa, and I said she had a broken tooth, and I phoned my dentist and I said, "Look, your patients, we private patients, can we get it in?" And they said, "We put on the list, but she'll be number 400."
Hmm.
So there's a waiting list for private patients of 400. So
Wow.
I was just really, really lucky that I, had this dentist and I could see them. I feel my mum has to travel half an hour to see the dentist.
Mhm, mhm. I know obviously dentists in the UK at the moment being a really hot topic. There's a
Yeah,
dental desert across many parts
mm,
of the UK. I think the big cities are really the only places where
yeah,
you have a good chance of finding a
mm,
dentist. Uh, we're not even talking about NHS dentists here. We're
dentist.
talking
No,
about private
yeah,
practice, and then the cost associated with that is another whole other topic. But yeah, oh gosh, yes. So really lucky that you were still also you had your dentist and also by the sounds of it a very good one who spotted it.
very, yeah,
Yeah, and then what was the travel like? I assume the rest of your treatment was NHS in terms of.
yeah, yeah. It was. Obviously my husband went into, I've got to sort this out mode, and we have private medical through his work. So he phoned and he spent that night online finding the lead person that will treat mouth cancer privately. uh, so we did get an appointment, but I then once I'd spoken to Andrew's nurse, I said, does he do anything private? And she said he would never do this privately. He said the hospital he works from, the staff will never be able to deal with you with what is could happen. So don't even think about that.
Mm.
So we sort of cancelled the appointment. It was, I don't know, some man up in the Midlands, and I know that we had Christmas in the way, but everything happened really, really fast after that. So I was going up to Barnstable Hospital, which is an hour away, and then he said, "I want to take you in. I want to cut that piece out of your tongue, laser it, and get it a biopsy of all the area." And that had to happen in Exeter. A hospital in Exeter is about an hour and 20 minutes away if the traffic's good. So
Mhm.
I went in on the 25th of January and had that done. And I mean, I know everyone on these podcasts and everyone you speak to goes, "Oh my God, the biopsy, how painful." Yes. Why did they not tell me? Oh, just use your usual pain relief. Well, I was on codeine and double paracetamol and everything just for the biopsy. So I was like, I don't even know how painful this can be. And the lasering was awful.
Mm.
Um, and they were like, "Oh, we're so surprised it's so sore. We don't understand why." And I'm thinking, "Well, you freaking lasered my mouth. Of course it's sore." I don't understand why. I
Yeah.
felt like there was something wrong with me. Like
Yeah.
I was had this really low pain threshold.
I am so glad you're mentioning this because I mean, it still baffles me how it's possible because so many people have oral cancers. We know predominantly it is an elderly population, but you can't tell me it's just us youngsters who are complaining about this. And it makes
No,
me feel a bit like who's not listening and why are we not
yeah,
being listened to? And I was exactly like you. I felt like, oh my God, I must be such a drama queen.
yeah,
uh, what's wrong with me, instead of going, no, this is not, there's no adequate pain relief for biopsies
no,
in this country at least.
no.
So yeah, no, I'm really glad you mentioned that.
Oh, I could only for 3 days put ice in my mouth and let it melt. That was the only nutrients I got. So when you were talking about your constipation story, I was like, "Oh yeah, girlfriend, I'm there. I know
Yes.
that." And I was at a festival
Oh
a week later. Yeah, that was I was so after that, I thought, "Oh my God, I have to try and get food." Fiber tablets, I was just managing to get fiber tablets
no.
down my throat, so I didn't go through that
Mm.
again because, I probably should have gone to hospital as well.
Yeah, no,
Yeah,
absolutely. I mean, that is one of the big things I say every time when someone's going in for surgery, any type of surgery
surgery.
with pain relief, and I'm like, make sure
Yeah,
your bowels are taken care of, because it's the last thing you want after you've got open wounds and other things to worry about. It's the last thing you want. So you had, um, the tumor removed
what they
and
could see,
what
yeah.
they could see
Mm.
and lasered. What happened next?
So, 2 weeks later, got another call, and he said, "I'm really sorry, but your margins are not clear at all." He was like, "It's a 3.6 diameter growth, it's 2.6 millimeters deep or something. So you need to come in on Monday to talk to the team." So this was like on the Thursday. On the Monday, my husband and I go up to Exeter and they say, "Okay, this is the plan. This is what we're suggesting. We, cut as much of your tongue away as what we can, including another border. You'll need to have a flap. We also want to take all the lymph nodes out that side of your neck." And I had kind of done a bit of looking. I didn't want to look too much because I know that's just all, I know that's not, that'll scare the bloody hell out of me. So I thought, okay, but I'd looked at the flaps and where they come from. And he wants, because I'm right handed, he wants to use the left, but I'd broken this and had K wires put in. So uh, he was like, "I don't want to use your left, I want to use your right." And then he said, "Let me look at your legs." So
Oh,
showed my legs
okay.
and he went, "Oh yes." And he said something to, this was the plastic surgeon, and he said something to the Max Face guy, Andrew, and he went, "No, I think we can use her leg." So
Oh,
I was
that's
like, "Oh,
great.
okay. Um, are you sure? Because I'm actually diabetic as well. I got gestational diabetes with my eldest, and it never went away. So um, I was always worried about doing things to my legs, and they were like, "No, no, it'll be fine." So my husband said, well, what are our options?" And he said, "Well, you can do nothing, but we wouldn't suggest that. And we are to say, this on Thursday, this is Monday, on Thursday, we're together in theatre, so we can do it.
Wow.
We don't know when we'll be together again."
But we
And
can
I was
do it on
like,
Thursday. Wow.
"Okay."
Wow.
Yeah,
Okay, that's huge. So, because I'm just
yeah,
thinking, I think we found out in January what the plan was. I had at least 4 or 5 weeks to mentally prepare myself. And I was so great. I know people listen to that and going, oh, 4 or 5 weeks delay. I said, no, no, no. For me, I needed that time.
mm,
Also, I was stage 1, so early on. But I needed that time to mentally prepare myself and also to get all my affairs in order.
mm,
But you had
yeah.
days.
Mm.
Oh my God. I don't know if that's better or worse. What was it like for you?
It was I was petrified, but of course, everyone else. So we hadn't told the kids or anything because we kept thinking, well, maybe it's nothing. Like I could go and have the first operation, and I don't want them to worry. But now we had to tell them, like, this is it. I'm going in. This is, So yeah,
And how old are your kids at this stage?
the ones at home are 17, 15, and 13.
Wow. Okay. Oh,
Yeah,
teenagers. Ooh.
yeah, yeah.
What was this?
They've been amazing, they've been great. I'm very lucky, we're very lucky. So,
Yeah.
they've been great boys, and they've been very supportive.
Mm,
But boys are so hard to
yeah.
also judge how they're feeling.
Yeah. I was going to say, like, how did you? Obviously, you and your husband must have had a conversation, but how do you even approach that? The whole idea of having to break this type of news to your kids.
Well, in a way, we felt bad because we hadn't been letting them slowly get used to it. Like, okay, so mum, they think it's cancer. Everything was like we think. But I'm going in to have this big operation. So they were aware, and I could see they were worried. But they went back to their gaming, and that was it. So I think they survived that. And of course, I did the same. Trying to get everything together, making sure our will was where it should be, especially because we've got all these children, and um, wrote letters that I've obviously never given anyone, thankfully. But I cried a lot when I wrote those letters.
Mm.
Yeah, more worrying about them,
Hmm.
how
Hmm.
they, if something did happen to me, how they would feel. No time to think about me, to be fair. Just no time. Yeah.
Yeah, I totally relate. I don't know. I found myself in this weird bliss where I was like, okay, if this is it, this is it. I was a bit bummed because I didn't get to have a wedding. That was the big thing. I was like,
Oh,
oh, but I
yeah.
wanted this big ass wedding. I did, and I was a bit annoyed, like mostly like annoyed, but not
Mm,
like because I had so much else, and I considered myself so lucky, and I was so grateful. But I was really worried about what would happen to my mum and dad. I was like, oh
yeah.
God, my mum's, she won't mind me saying that, but my mum's bonkers at the best of times. So I was like, how on earth is she gonna
Yeah.
like cope with this? Um, and dad as well. But then also my partner, Nick and I weren't married. He had
Yeah.
no rights. I was like, oh,
Oh,
what's going to happen to him? He has like nothing. He's
yeah.
actually not even entitled to the clothes in the room, and I felt like I had to write this all down, and then also
Yeah.
letting them know what my wishes were.
Mm.
And weirdly enough, I think I'm much clearer about that now, 6 years on, 5 years on, no, 5 years on, not
Yeah.
6 years on. But yeah, so, oh God. And yeah, the letters. Do you still
Mm.
have them? I destroyed mine.
I still have
You
them.
still have them. Oh,
Yeah.
okay.
I told my brother where they were.
Yeah.
That, and that was it. So, yeah.
Yeah. Well, I guess they're there, so hopefully you never have to.
Have to. I know. Well, that's what so I keep them. I'm like, if they're there, then because my luck, I would destroy them and then I don't know, drop down somewhere. That
True.
would be it.
True. Life happens, doesn't it?
Yeah,
Yeah. So, okay, we're at the operation. You're going in. Everything's a
yeah,
rush.
yeah. get in there. Well, speech and therapy. Um, Speech therapist was trying to get hold of me. We had a long chat. Of course, they were like, you're not going to sound the same. You need to be aware of that. Even when you hear your voice, it's not the same as how other people hear it when it's on a record. She was trying to get all this stuff across to me, and I was like, oh my God, my job is speaking to people. What the hell? Um, so dietitian, because I'm diabetic, so I was worried about a lot of stuff about that. I was told I would have an NG tube, fine. As long as they did it while I was asleep, I was like, that's fine. Um, they decided that I would be in ICU and they would wake me up with my intubation tube still in to check how my breathing was. hmm So,
Oh, okay.
so yeah, they told my husband 9 hours. He started phoning the hospital at 9 hours in, and no one could tell him anything because the ward didn't know where I was. 12 hours later, he got the phone call from the plastic consultant saying everything's fine. So he was an absolute wreck because he said to me, I was convinced you were dead. That was it. Like, why would no one phone me? So,
Yeah.
yeah,
Yeah,
I woke up. Yeah.
communications,
Oh,
but I don't think anyone's had a great experience. Mine was the same. He didn't,
yeah,
it always takes longer
yeah,
because your op, I assume, was about 12 hours as well
yeah,
in the end. So mine as well.
yeah.
Yeah, he rings and he's like, nobody knows where she is. Like, they've lost her.
Yeah,
It's like, no,
yeah.
no, still there.
I know. And I mean, I understand that because I have a medical background.
Mm,
Most people don't. I've been on the other side of it, and
mm.
someone phones you and you like going, oh, they must be in theatre still, but no one answers when you phone theatre, so
No, and you're dealing with
yeah,
what's in front of you here and
yeah,
now. Not,
mm,
yeah, no,
yeah.
totally understand
It's
it.
Yeah, it is difficult, but I feel just desperately sorry for my family that were waiting for that call. Um, but yeah, I woke up the next morning, sort of started coming round, realized I was in the ICU, the most like angel woman looking after me because they were just incredible. And she said, "Okay, you've got this tube still in." I was like, I can feel that. I was trying to talk, but I couldn't really talk. And they were just updating me, and I could hear they were doing the doctor's round, and I could hear them get, getting closer to me. And then the next thing, this doctor's looming over me, going, "Okay, we're going to look at taking this out in a while." Thinking, "Well, can you just do it already?" Like I was really nervous about what was going to happen. She said, I need you to take some deep breaths. And of course, every time I can breathe, I can feel this like something inside me. And then she said, I need you to cough. And I thought I was drowning. That's,
Mm,
oh, it was awful. And then they decided they were going to take it out. And I, I, I've, the worst thing that could have ever happened to me was that. It
mm.
was, pulling this tube. It was so long, and she kept. And I
Oh,
could see this over my head, while she's
mm.
pulling.
So this
And
this is a tube that
yeah,
goes in through your mouth or through your nose?
it went into my mouth
Mouth,
and into my lungs
lungs, yeah.
to yeah,
Because I'm familiar with the NG tube because
yeah.
all well
All have those,
we
yeah.
all had
Have
those and woke up
those,
with
yeah.
those. But yeah, no, I woke up. I was yeah,
Yeah.
God.
I I have no idea why. Um, I mean, that's what they decided to do.
Mm.
So,
Maybe I can only assume they were worried about swelling
yes,
because I know a lot of people end up having
it's tricky,
a
yeah.
trachea
Mm.
for quite some time. So in a way, but yes, to do that whilst you're awake. Oh God, yeah. Oh dear.
Well, it felt like it took hours for her to pull this thing out, but obviously it wasn't because I
Mm.
know it's not that long. And as she pulled the end out, all this fluid came flying up and back into my hair and my face. And I mean, my eyes were like, "What the fuck?" And she said, "Don't worry, it's sterile. It's only your lung fluid." Like, oh, can someone
Oh,
wipe it off? It was
oh.
horrific.
Well, I do remember, like, because I thought to myself, I've got
Mm,
photos and I was a mess. I was like,
mm.
could someone
Yeah.
just not wipe my face? I mean, there was blood like
Mm.
everywhere. There was goop and there was probably lung fluid. And I was just like, why? And it's all in my hair. Oh,
I
God.
know.
Yeah.
Oh, ugh,
Ugh,
yeah,
ugh.
ugh. Yeah,
Okay.
that was not fun. Um, I ended up in ICU for 3 days because they were struggling with my blood sugars and struggling with
Hmm.
my blood gases and all these different things. And I was okay while I was there. My mum and my husband could come and visit me, and they there was only like 2 hours of the day they couldn't be with me. So there was someone there all the time, and I was just sleeping and waking, having someone check my mouth every half hour. That was fun. Um,
They do come
yeah,
and prod you all at the most ridiculous of times, don't
I
they? You're
know.
like, why now? I want to
Yeah.
sleep.
And, there was you're lying there, and so all these things are going on in your head. So, especially as I'm a nurse, I had this nurse, she had me for 2 days. So she was, walking around, and she was very calm, and she did everything really slowly. And then in the evening, I had another nurse who was like, "Ah," frantically running around and, like, bumping my bed all the time. And I was like, "Why is she bumping my bed like that?" Completely different energy from her. And she said, "Right, we can do a bed bath now or in the morning, but we'll do it now." And I was like, "What? Bed bath? You're joking, right?" And she's like, "No, no." And then, I mean, I've never had a bed bath, so I've done many a bed bath. Roll over, we can clean your bum now. What? It was, I was very
You
sorry.
you do have, it's like I remember that, and I remember you're doing what, and and the worst, well, with me, it was during the day, and my husband was there, and I actually went like, "Can he do it? Can you show him?" And then from then on, he did it. I felt much
Okay.
more comfortable with him
Yeah.
doing it, but it was just weird.
Mm.
But there is a whole element, and I'm sure you felt the same. They came upon. So I'm a control freak. I used to be an event organizer. I live by lists, and I'm in control. And I'm sure as a mother, it's no difference
Yeah.
because you are in charge,
Mm.
and as a nurse, and
Yeah.
in the police.
Mm.
And I very early on realized there comes a point where you just have to surrender and
Yes.
just go,
Yes.
I am yours.
Champion.
You do
Mhm.
what you need to do,
Absolutely.
and let go of. And it was like letting go of every single one of my instincts that I had. It was
Yeah.
such a weird experience.
Yes.
Yeah.
Absolutely agree with you. That was exactly what I had to do.
Mm.
Especially when the second night, the nurse came in and she said, because they couldn't move my neck at all, so I had to have someone rolling me, and she said, "Right, I'm getting some help." And I was like, "Okay." And these 2 guys came in, 2 male nurses who I hadn't seen any male nurses up to this point. And she was like, "Well, I'm gonna roll you over." And I was like, "Oh my gosh." Just yeah, just go with it. What can I do? You
Mm.
know, they're I know they're nurses, they probably used to seeing 100, but for me, it was the first experience of that. So, yeah, not fun.
Mm.
Um,
You do get to, I don't know, it's like psychological. I realized for a really long time, well, actually, even still now, um, you probably know what I mean by the medical touch. Like for such a long time, I was touched in a way that is
right.
always medical. And I was
Mm,
like, like I said,
mhm,
rolled around and
mhm.
lifted up and put down. And I'd realized that I really struggled for a while to hug people
People, yeah.
because I wasn't used to being touched any other way than medical, and it almost was a bit of a like, oh, if you're like consoling me or if you're giving me it must be something bad. But
Mm,
then actually,
yeah,
yeah, it took me a while
yeah,
to come out of that.
yeah. Took me longer.
Well, it's not that long ago, let's be
No,
honest.
no,
Not at
no,
all.
no.
Yeah.
And I know, when, I first said, "Oh, I'll do this," I was in a completely different place to what I was a month ago or what I am now, because that, yeah, it was like I was almost living in a dream when I came out of hospital,
Mm.
because I then got taken to the ward, still with all the drains and everything, but they took me like 4 o'clock in the morning. Like, why must we be here, at this hour? I think I was so stressed. I started getting a migraine because I do suffer. So, and they were, I had this morphine pump and all this sort of thing, and and nothing was helping my head.
Mm.
And it was that day that my husband brought the children to see me, and I mean, I wanted to vomit most of the time, so they pumped like 3 or 4 different things into my veins to try and stop that from happening because, that would have just been horrendous. Um,
And dangerous
and dangerous,
for
exactly. Yeah,
infections, yeah.
yeah. So, I was trying to get through that, and the kids came in and their eyes were like saucers. I mean, you tubes, drains, everything, it's all happening. And I said to my husband, "I don't think you can do this. Just like you need to just take them out." So they were pretty shocked. He took them to McDonald's, and they were still, my
Mm.
God, our mother. That was not a good way to see me. And so from then, I was like, I need to get better because I need to see my children, and I need them to know that I'm okay. And yeah, you're kind of living in this weird reality for the first week of being in the hospital. I was in the ward where I was opposite the nurses in my own room, and my friend came with my husband had told her about the fluid in my hair, and because I hadn't even messaged anyone, so for all those days he had like got a WhatsApp group for all my friends that wanted to know what was going on, and he was updating them. She came with dry shampoo, and she dry shampooed and plaited my hair because I think you said you had a plait, didn't you?
Yeah,
Yeah,
yeah.
I was really wishing I had a plait
Yep, yep.
because
For long hair, I would recommend. I
yeah,
went to the hairdresser to get a plait,
get that.
and I got it. Also, it was really
Yeah,
good by the hairdresser because they thought about the placement of it,
place.
so I could lay on it without it,
Yeah.
like because you get a
Mm.
neck ache and things
Okay.
like this. I
Mm.
mean, I have this side plait all the time now, but I struggle with my neck because of it. So
Yeah.
I should really have two on each side.
It's like, yeah.
But yeah, yeah. So no, the plait is definitely a good tip.
Yeah. Oh,
Mm.
absolutely. Yeah, she did that for me. And then, they came and they said, okay, well, you need to go to the toilet. You need to get your bowels working. And I was like, but I've still got this catheter, which I hate. And, I was like, that I'm not going to be able to go to the toilet with that catheter. And I sat on the toilet. I was like, oh, no, it's not working. That actually hurts.
Mm.
So I was like, "Can you just take that out?" So, luckily I got rid of that because that was one of the worst things.
I was going to say they took mine quite early. Like,
Yeah, I wish that.
well,
Well,
I think I can't remember. Oh, I actually no, I can't remember. I say that. I was high for most of it. No, I
most of
can't remember.
it. The problem for me was, I was polyuric, which means I was m making loads and loads of fluid, and my catheter was filling up while I was in ICU. Just a reaction to everything,
Hmm.
probably part of the diabetes. So, they were like having to empty it all the time, and I would say, like, "Please, can someone empty this? It's hurting." So I just really wanted to get that thing out.
Hmm.
And once that came out, and then the drain in my leg, oh my God, it was so sore coming out. And so when it came to the neck, I thought, oh Jesus, but the neck was nothing. Never felt it. But
Mm-mm.
the pulling that drain out of my leg was really sore. But the amazing thing about the leg is, they took a piece of skin and two veins in an artery, um, slapped it in my mouth, sewed my leg up. So drain came out. I've got, the kids call it shark bite 24 because it looks like a shark bite. It's
Mhm.
about almost 10 inches up up my calf,
Yeah.
but closed.
Oh
That
wow!
was
So
it.
just a line, not like
Yeah, it kind of weaves
a
its way,
weave
follows
line.
the vein.
Mhm.
It's perfect. They said, "Get up, do some walking." Okay, I got up, I did some walking. No, I felt so happy that I had that, and not like you poor guys with skin grafts and oh no, I really, really feel very lucky to have had that.
I have to admit that that
No,
bloody arm was
yeah,
it just took so long, and I still have trouble with it now. And
mm,
the only way to fix what I have now is to redo the whole thing, and I'm like, "Oh, no,
yeah.
there's no way of going
There's
through
no
that again.
way.
No,
Yeah.
no, no. There's no way of going through it." But yeah, so and I guess the rehab on your leg must have been minimal in that sense. It just had to heal and then
I said when
scar.
the physio came around, I said, "I'm really worried about going up and down the stairs." He went, "Well, let's go." And then I walked up and down the stairs. I was like, oh, that doesn't even hurt. Like,
Oh, wow.
so for a few months, every time I got out of bed, it pulled a bit, but it
Mhm.
wasn't painful. It was just like a stiff muscle.
Yeah.
Absolutely amazing. So super, super happy about that. And then I was like, right, get this feeding tube out. I've had enough of it. And I had all the dietitians and the speech therapists coming around and doing all their bits, and started with water, then onto, like some fluids and Ensure. And I said, it was absolutely painful trying to swallow. It was awful, awful trying to get that anything down.
Did your NG tube move as well? Because mine
It,
kept
wa-
riding up. So
it
by
was
the time,
stitched
oh, you got, thank God I did not have it stitched. I did not. I had a plaster, but it had ridden up
up.
internally, and I could feel it. I was like, every
Oh,
every time you're feeding me, I can feel the spugger going down, and it's not nice.
oh,
And it started
no.
to get painful. By that point, they finally whipped it out. But that was a weird experience. Ah,
Oh,
again.
yeah, we're gonna give you some water. Oh, yeah, I can feel that. What's that? You could feel it at the back of your throat
Yeah.
every time they gave you medicine and water. And I'm really thirsty. Can give me some water, please?
Mm,
'Cause I was just thirsty all the time.
mm.
And I didn't tolerate a 12-hour feed, so I had continuous 24-hour feeds.
Oh,
I still
wow.
managed to lose, um about almost 2 stone while I was in hospital because I ended up being there longer.
Mm.
But, the first week, I'm like, "Right, I want this tube out, I wanna go." I was begging them to take this tube out. I just 'cause it just pulled on my nose all the time, and I just wanted it gone. And, um, and I was also having, I think someone you spoke to was hot. Oh my god, I was dying. It was so hot in this room. And luckily a lady consultant came in and she went, "Look at this poor woman. Get the window open. Get her a fan. I was like, "Oh, love you. Thank you." Because she obviously could see how I was just struggling with the heat.
Mm.
And, uh, they I was like, "Right, get this tube out. I'll go sit at home. If it takes me, like, all day to swallow something, I'll do it at home." So, tube came out, they moved me. I had a shower, like, even while I had the Doppler on my neck. I was like, "I'm showering. Someone needs to make a plan." And the consultant was like, "Well, can you just shower?" I was like, "No, hair wash. Gotta wash my hair." So, again, lucky, my hands were fine, I only had a drip on, IV drip. So I got into that shower and washed my hair, and it was the most
Wow.
amazing thing. Yes.
That's incredible. It took me weeks
Mm.
before I could even, I mean, I remember having my first bath, and it was a very shallow bath because I had
Gosh.
to sit in it like that. But
Yeah.
I was just like, "Oh, this is so amazing!" And I remember I took a picture and put it on like Instagram or whatever, going like first amazing bath. And I had someone comment go like, "Oh, Barbara, I think you can allow yourself to have like a proper full bath." And I was like, "I can't. I literally can't. But this is good
God.
enough."
Well, I don't know how you guys did that. That's why, again, I was just like, "Thank God you did this on my leg," and
Mm.
that, I mean, it was really hard to wash my hair with, like, I had
Yeah. The
plastic all over my neck to try and not let the Doppler get ruined, and I was like, "I don't give a shit about your Doppler. I need clean hair, people," just just do
Ah, the bloody
it
Doppler.
yeah,
Oh, I think
thank
actually, I
you.
think we just need to quickly, in layman's term, explain what a Doppler is,
Mm,
because I bet with you people listening, like, what on earth are they on about a Doppler? But it's how should I describe? It's like a cable that gets attached to the flap, and it makes sure that blood is circulating through it so it doesn't die. That's how I would, and it
yeah,
makes a noise like,
mm.
duck, duck,
You can hear your blood flowing,
yeah,
yeah, it's
yeah.
basically, yeah,
So,
and
yeah,
every half an hour we had to hear that, didn't we?
yeah, yeah.
And every half an hour, someone would come with a big spatula and say, "Open your mouth, please." And you're like trying to open when your tongue's already like, oh. And it just amazed me that as well. Some people they would use the KY jelly and put the handheld Doppler on my tongue. And I think they put a stitch where they would hear it. So they always knew where to go. So we didn't have, there was only once where someone panicked. But half of the nurses would clean the KY jelly out my mouth, and the other half wouldn't. And it was
Eh,
amazing. Yeah.
why would you
They would
not?
I know. It's funny.
Yeah.
And so and I spent so much time after that because I was in hospital for almost a month after that.
Hmm.
Um,
That's interesting because so you had someone to come and manually take the Doppler.
once they removed well, they were checking my tongue as well as
Yeah.
using the with the handheld Doppler,
Yeah.
as well as turning the Doppler on and
On.
off for my
Okay.
neck. Yeah,
Yeah.
yeah. Um, and then so I was like, "Well, I'm going home on Sunday. That's it. I'm leaving."
I just need to rewind. Did you just say you were in hospital for a month?
Mm.
What? I mean, I thought
Yeah,
mine was long because I kept fainting, but a
yeah.
month? And is that because of
Well,
the diabetes and the sort of that?
not we don't know why. Basically, I managed to get a secondary infection in my neck.
Hmm.
So I was trying to I remember Saturday my husband came to see me and we used to go walking to the restaurants in the hospital, and I had my feeding tube my no it was my IV still on, and we walked all the way down, and I was really leaning on the IV stand, I started feeling really tired and just not great. And I was like, oh my God, I think this whole thing has hit me now. So we went back to the room and I said to him, but I'll be in my own bed tomorrow night. I can't wait. This is gonna be great. And I went to bed um, that night, and I was woken up quite early in the morning by one of the registrars. They used to come around before the doctor's rounds because I think it was the weekend doctor, so they didn't know everything. And she said, "Why is there blood on your pajamas?" And I was like, what do you mean?" And I was like feeling around my neck, and the whole wound had opened up. And I had an idea that something wasn't going right because they used to come every day and take my bloods. And I heard them talking about my infection levels, my white cell count
Hmm.
and CRP or whatever. And my son had a few years ago got a bone infection during COVID. So it took quite a few weeks to get it diagnosed. And, they realized something was wrong when they took his bloods and saw how high the CRP level was.
So they knew there
And
was an infection, but they just didn't know where.
when I said, "Well, what is this? How much is it?" And the nurse went, "Well, it's about 30, and, it should be below 4, but it can go up to 400, so it's fine." And I don't ever think I remember having a temperature in my life, not with any flu or COVID or anything do I remember having a temperature.
Hmm.
So I'm just not a person who gets a temperature. And I did get, well, tiny, I went up one night and had some paracetamol when I came down. So, yeah, that happens. They
Yeah.
didn't they
We're all so individual in
individual
terms of
exactly.
our. Whereas I know I'm all well. I I know I don't get a fever. I don't get high fevers.
Yeah.
So when I'm a little bit over, that's for me already
A lot.
quite a
Yeah.
lot. Yeah.
Yeah,
Yeah.
yeah.
Oh
Uh,
God.
so
So
so they had a look, and they could see it all opened up, and yeah, I could feel it starting at dehisces, so it like was opening, and every time I spoke, I could hear this like it's like almost breathing through my neck. It was such a horrible sound.
hmm,
And they took a swab straight away, sent that off, started antibiotics. It actually, strangely enough, on the Friday when my consultant had the one that did the operation, he came around and he stood next to me and he sniffed me and he went, "I can smell something." Started on whatever antibiotics,
hmm,
and obviously, he
who
knew that
knew?
something. He thought that it would be just able to be treated with some oral antibiotics, but no. So that Monday, um, I didn't go home on Sunday. They said, "Sorry, we're gonna have to put the tube back in." What? While I'm awake? Yeah.
Hmm.
So I had to have the tube back in, which was as awful as I imagined, but not as awful as I imagined, if you know what I mean, because
Yeah.
the nurse that did it was just amazing and beautiful, and she was so good, and I've used a lot of mental relaxation that whatever I could muster, having put these tubes in people for many years, I knew how, what would help. So yeah, and yeah, that was plastered to my nose after that, and I can't even tell you how many times I had to go for an X-ray to check where it was because they couldn't get any. They would
It's
aspirate,
block, yeah.
and they would try for ages. And because I'm diabetic, what would always happen was someone would come and give me insulin in the morning, and then they would not be able to put my feeding tube back on. And oh Lord, it just went on and on.
Hmm.
But they got me back to theatre really quickly after that, and they put another drain in. And the other thing they did was they thought, like, at the very back of my throat, so kind of where your wisdom teeth would be, they'd cut a lot of that area out, and they thought there might be a hole that was so far back and so tiny that could have dripped food, so down into my neck.
Hmm.
So they put a medicated ribbon in there. So they shoved, it's like like you can imagine a ribbon.
Yeah.
I had this like feeling in my mouth that someone, like, I had been having Jaeger shots. It was like all those sort of,
Okay.
so that was
Well, it
stuff.
depends if you like Jaeger or not. It could be a bad or yeah, good or a bad thing.
Love
But yeah,
Jaeger.
okay. Oh, good.
So it's fine. But I kept getting this like cloves and, I don't know, this like really medicated taste in the back of my mouth. And they came, everything went well. I felt so much better having the drain back and, like not feeling this horrible feeling going on in my neck. And the second day, I was like, so what's going on with this thing, this ribbon thing? And they went, well, we'll take it out. So the idea is that you heal and it pushes the ribbon out. So you heal from the
Okay.
bottom and it pushes the ribbon. Oh, okay, fine. Because it's stitched in.
Yeah.
And so I was like, well, how are we going to get it out? No, we have to take it out. Maybe when you've gone home already, and then we'll take it out. Okay, fine. And then the next day they said, sometimes people cough them out. Okay, that's a bit different. What? So,
Oh, they do some really gross things with our bodies, don't they? It's just
and
like,
they,
who's come up with that idea? But I understand the logic, because actually it's better for your body to get
yes,
rid of
rid
something
of
than having to
something. Yeah.
pull something
Yes,
out. So
yes.
yeah, yeah.
So I thought, okay, I don't know. They saying mixed. They're giving me mixed messages here.
Mm,
So, and what happened is every time I bent forward, it would sort of fall out a bit, and I could
mm.
feel it in the back of my throat, and I was like, like choking, and there's nothing you can do. I'm not allowed water. I would have to avoid bending forward at all costs. And also sleeping, I was sleeping right upright because as soon as I lay back too far, I could feel it in the back of my throat.
Oh no.
And yeah, it was about 3 or 4 days later. I don't know what happened, but it moved and I started coughing. And I stuck my hand in and pulled it out, but it was still stitched. And the health assistant that was with me, she was like, "Oh!" Screamed and panicked and ran off. She went to find someone, and the next minute, like, half the ward arrived to see what was going on with me, and I was, like, standing there holding this thing, like, going, I think we got a problem." So I let one of the nurses try and get it, but she obviously needed to get the stitch to pull it out.
Mm.
And I said, "Can you not just cut this?" And she was, "Oh my God, no, that would be a choking hazard, just
Oh yeah,
wait."
because it could fall back down.
Back
Yeah.
down. So yeah, the registrar came up and he said, "Can you open your mouth as wide as you can?" And man, it hurt, but I stretched my mouth as far as I could
Mm.
because I wanted that thing gone.
Mm.
And eventually he did. He managed to get the stitch and pull the stupid thing out. It was disgusting. It looks awful, but
Oh, the things we have to go through. And there is no way when you're sitting in this room or getting a phone call and someone says to you, "I'm really sorry, it's cancer,"
mm,
that you are thinking about a ribbon in your mouth
no.
that you'll cough out.
Mhm.
It's just, oh my God.
Yeah.
Oh, Candy. Oh. So so
And all you
you're
can do is laugh and go,
yeah.
"Oh my God, this is it." So I was there for, almost another 2 weeks after the neck, the drain was put in,
Mm,
um, which was great because by this time my throat was not half as sore as it was 2 weeks before.
mhm,
So when it came to starting to eat, it was so much easier. They did do what they call a blue dye test, where I had to put blue dye, which I was hoping would be in a bit of water, but no, it was just pure food dye. And I had to swirl it around my mouth and then swallow it. And then they wait 24 hours to see if it leaked out of my neck.
Yeah.
And it didn't. So they were like, oh, great. If there was a leak,
It's all
it's gone.
watertight.
It's
So
all
good.
watertight. Yes. Yeah, watertight. So, so yeah, getting back onto that was much easier. And I did say, I will not be eating your puree diet. Don't even bring me that crap.
Oh, really? I loved it. I was all over that. I was like, oh, I love this grandma food.
Oh, no. Oh, I mean, the first time they took the tube out, I tried to eat some of it because I knew I needed to go home. It needed salt for a start. Everything needed salt. They like bring
Yeah, yeah. I'm just
the
trying to think.
chicken and everything.
Well, it's because well, to be fair, I think I made good choices. So I had, I think it was like a shepherd's pie or something like that, which was really good. And so, but the funniest thing I still think is the reformed carrots and peas because they mush and then they put them in
And then
little,
I
yeah.
know
But it really tricked my brain to going, oh, this is carrot, and it
oh,
tasted a lot more like carrot.
carrot. Yeah, I mean that's the idea
I mean, it
behind
was
it.
way too orange. There is no way that was just carrot.
And then the expiry date is like 2028. I'm like, what is in this that they can keep it? Because it came with this lid, and I was like, nah,
Oh, I
sorry,
did it.
I'm
I
not doing
didn't
that.
see that. Oh my god.
I was like,
Okay,
no,
so ultra
that can't be
processed.
right.
Yeah,
Yeah,
fair enough. Yeah.
I was like, just bring me. I said to my husband, bring me my oxtail cup of soup. I put bovril in it.
Mhm.
I'll just live on that. So, ice cream,
Yeah, love ice cream.
cream caramels. Still don't stop eating them all the time. That's
Mm.
my go-to because I don't know why.
For me it was chicken soup. I had an
Mm,
absolute obsession with protein because someone said to me, "Oh,
mm.
protein helps you heal," and I was like,
Yeah,
"Everything has to be
everything has to be
protein."
protein.
But I have to admit, I really struggle to eat chicken soup nowadays.
No.
Thankfully, I still love ice cream, but yeah, chicken
Yes.
soup is.
Yeah, ice cream is definitely one of the only things even now. When I got home, I ended up getting home on Mother's Day,
Mm,
so that was great to be able to be home with my children. Um, and my friend had this huge crock pot that she'd made with chicken and vegetables, and then also pasta and pesto.
mhm.
And because I really, really don't like a puree of any sort, I don't even eat gravy. So
Oh, okay, so it's
yeah,
like a
I just
no
I
go.
can't do it. Yeah, but we pureed this up, and there was so much garlic in it, and I could actually taste it, and I was
Mm.
like, "Oh my god, I love this!" And I could only have a little bit, but she had to make a few of those for me
Oh, bless her.
that I put in little bags and kept in the freezer. Yeah.
Mm. Amazing. So then I guess healing continued.
Yeah, still had an open went home eventually with an open wound. They said to me if they'll take the feeding tube out and see how I go, but they might have to put a peg in just so I can get home.
Mm,
Um, but I really worked really hard on getting fluids into me.
mm,
And yeah, because it wasn't that sore after 3 weeks, it
mm.
was much easier. Um, yeah, got home and before we went home, we also got the news that I didn't need radiotherapy or chemo.
Oh, great.
So it was at that point that I started to feel like I was going to cry. There were a few times when I felt really down being in the hospital. I was like becoming institutionalized. And I would say to the nurses, "Oh, do my feeding last," because it took the longest for them from
Mm.
everyone that was in the ward. Um, and people came and went. It was awful. I had
That's
a,
the
a
tough one.
patient,
Yeah.
yeah, I had a patient. She was next to me, and she had dementia. Not sure why she was in our ward. I think they were overflowing, and she was a bingo caller, so she literally called bingo numbers all night. And I was like, said to my doctor the next morning, either you give me a sleeping tablet or you give her a sleeping tablet. But he
Oh,
went, well, I can't give her one because she's not my patient. I'll give you one.
yeah.
So I had to have a sleeping tablet every morning. And then I would get up at 6 o'clock to get into the bathroom because there were only 2 bathrooms on the ward, and there was 8 beds in my ward, and then there were, a few others, one 8-bedded male ward, and, I knew they cleaned the toilets overnight, the bathrooms, so if I got in there first, then it was all clean and I could wash my hair.
Yeah.
Yeah, it was
Oh
really
God.
hard, and when I came home, I would sleep and then wake up and go, "Oh, I'm not in the hospital. Oh, thank God," 'cause, I used to wake up thinking I was still there. It
Well,
took a long
after
time.
a month,
Yeah,
totally understand
yeah,
why.
and, yeah, I said my husband had said to me many times, "If you're sad, just cry," and I was like, "I have a tube up my nose. I can't cry. I will have to blow my nose, and it will be a mess."
Mm,
I cannot cry.
mm,
So I had to really not cry. But when they came and said that I didn't need anything, they said that all the nodes they checked were clear, and so they felt that it wouldn't be beneficial to do it.
yeah.
I did have a little cry of sheer relief
Mhm. Mhm.
because even that I hadn't actually started thinking about until about 2 days before I was going home. I then started thinking, "Oh, hang on, this might not be it." Just
Mhm.
getting through everything in the hospital and, just seeing other people on Young Tongues and the mouth cancer support group. Oh, I just thought, "No, I can't do it. I
Mm.
don't know. I don't
I
think I'll have
mean,
the strength."
I am really happy for you that you didn't have to do
Mm.
it, but I would also say you would have got through it because you're a tough one. You got through that experience. You would have got through the radiation or the chemo. I think that's really important. But we all know that it's just a horrendous experience.
Yeah.
But people make it through it, and that's the most important
Oh,
part.
I was listening to Jamie's experience the other day
Mm.
on the podcast and just thinking, "All right, if I ever need radiation, I will go with the peg straight away." Like, I won't even think about that.
Yeah.
Because honestly, oh my God, oh, no.
I would be yeah there's a lot. It's really interesting, like some of the conceptions I had before getting cancer and after.
Yeah.
And I'm someone now who I quite happily just go, give me all the drugs.
Oh,
I
yeah.
don't care, just give me all the drugs, because I'm not here to live through that pain, and I know sometimes pain gets out of hand,
Yeah.
and I'd much rather try and manage it from the beginning on. I'm also I used to be a bit cynical, I guess is the word, about alternative stuff like meditation or yoga or reflexology or what's the one with the needles?
Right. Oh,
um,
acupuncture. Yeah.
Acupuncture, like all these things. And actually, I don't think we should even call it alternative because they're
No,
supplementary treatments.
treatments.
And
Yeah.
I am up for trying everything alongside my regular treatments. I with chronic fatigue,
Mm,
I do cold water exposure.
mm,
There is
mm,
no way I would
mm.
have ever done that before, but now I'm like, oh, this is really helping me with like regular pain and also energy levels and all of that. So, speaking of cold water exposure, Kathy.
Yes.
So, um, excuse me. I have been noticing on the group there's daily photos of some
Yes.
crazy woman jumping
Mhm.
into the sea. But I mean, wow, I love it. Can I join you?
Yeah. Anytime.
How's that been?
Well, before all this happened, I had been getting into the sea with 2 friends at least once a week, sometimes twice a week. Our husbands all have surfers. My husband surfed since he was like 10 because we lived in a city in Durban where we grew up and we surfed. I even did a bit of surfing. But then, here I was like, I don't know, it's a bit cold. But about 2 years ago, we started. And all I wanted to do when I was in hospital was get back into that sea. I was desperate. And I knew that next weekend is no, it's this weekend,
Yeah, it's
is the
this weekend.
walk.
Mm.
Um, and I started talking to my friend who brought me my chicken soup, Sarah. She's my lifesaver. Um, about she's one of the girls I get into the sea with, and I said, "Oh, I feel like I should do it." And she said, "You are not ready to go doing anything yet. Just calm down. She said, and also it's my birthday. And I was like, okay, yeah, you're right. I'm gonna go to London on your birthday. She said, why don't we do something here? Because I said, oh, they do have you can walk,
Mm.
um, for the month or whatever. And her and my husband were like, we don't really like walking. Can we do something else? So we decided we would get in the sea every day. So, um, we get in, if there's waves, we surf. I can't surf properly because I can't paddle. I haven't been able to lift my arm since
Mm.
my neck dissection. And yeah, we're hoping. I look like Nemo, sort of flap with this one arm. So I can't go anywhere where I can't stand. I need to be
Yeah.
able to stand and jump in front of a wave as opposed to paddling. But yeah, we've been doing that, and it's been great. I mean, I keep thinking, why can't I do this every day for the rest of my life? But trying to organize four of us
To
is
go
quite
together.
difficult.
Yeah.
Yeah. So Sarah's come with me every day. I've never been in without her. But my husband's there's been some times when he's gone with my son and with Sarah's husband, and we've just got to mix it up a bit. So,
Absolutely. It looks so much fun. And I so
oh,
relate because um, anyone who follows me on Facebook will see my lakes in
in
Switzerland all the
Switzerland, yes,
time. And I can't, because I'm going back in October. And I said to Nick, I can't wait to get back in
Switzerland,
in the lake. And he said, you
yeah.
do realize there's snow? I'm like, yeah, I don't care.
Yeah,
I don't
yeah,
care.
yeah.
I
I
said,
mean,
I won't be going out in the deep end, mind you. I'll probably just sit in it and then 3 minutes later come,
uh,
but
well,
yeah.
I think you're braver than me, because I'm covered in rubber.
Oh
I'm
yeah,
in
you've
a
got a
wetsuit.
wetsuit.
Yeah, I'm
Oh,
in a wetsuit
but
because
you're in the sea where, I'm in a nice calm lake. There's not much in a lake that can bite me, so there you go.
there's not much in the sea. Yeah, that can bite me either. It's been an amazing experience in for many reasons. Um, that we've done it at different times of the day, and so that has been so. The beauty of where I live is just even more astounding
Mm,
because it different times of the day is so different. The different tides that have been in storms. We were in 2 days was just storming and it was absolutely scary, but it was, and then some day, yesterday there were hardly any waves. There was nothing. We were just paddling around like because there was nothing. So just so beautiful.
mm.
Um, some amazing sunsets, and almost every day someone has said how it's inspired them or made them feel better on young tongues and the mouth cancer group. And that's all I want is, if someone is looking at that going, oh, okay, if she can do it, I can do it.
Yeah.
That's the important thing.
Absolutely. No, absolutely. And I think there is something so valuable after you've spent some time in a hospital where you couldn't, having your freedom restricted, to then to be able to go and reconnect with the things that you love, and especially with nature. I think it is so helpful for any type of healing, physical and mentally. So
Yeah.
yeah, I'm totally with you. So yeah. Oh,
Yeah.
Candy. Oh, we've been chatting for an hour. I thank you so much. This has been such a delight, and thank you for sharing everything. Now, I just want to have one final question.
Yeah.
Is how do you feel about your life now and the future?
That's a hard one, isn't it? I mean, I've listened to some of your podcast guests, and they're all doing these amazing things, helping other people, and um, I'm selfishly just hoping to be able to work back with my patients at some point. I haven't done that yet. I've been back at work for a month, but I'm just doing anything but talking to people. Although my manager did say, they're not going to be worried about what you sound like. They're more worried about themselves. So,
Hmm.
so yeah, she's right. And I think that's important for all of us to remember. Um, yeah, I'm hoping that next year I will be able to do the walk and meet more people. I have managed at last to go to a swallows group, uh, support group, because that's also an hour away, which was a bit of an eye opener. But I think I would definitely recommend, when you're ready, for anyone who's had this to go and see other people, because I'm the only person here I know
Yeah.
that's had this, so, um, yeah, just getting back to normal. I don't know what that is because I'm always tired and I can't lift my arm, so they might know, "Oh, the new normal."
New
That was my speech
normal.
therapist's
New
favorite saying,
normal.
"Your new normal." Because I remember going the last time I went to see my consultant, and he said, "How are you?" And I was like, and he went, "Oh, let me guess, food doesn't taste right, you're not eating that much." I was like, "Oh, you bastard, you knew this all along, and, you didn't tell me."
Yeah.
But every day is different, so I'll just keep day by day, hour by
Mm.
hour, being positive.
Yes.
Yeah.
Yeah. And that's the thing, because also you're not that far out. And I know when we
Mm,
first were in contact, you were
mm.
literally really not that
Oh, it's
far
like,
out. And
oh,
I went,
right.
Candy, let's wait. Let's wait at least until October. And I was
Mm,
like, believe me, you need time.
yeah,
But it is incredible how our bodies continue to heal and our minds continue to
to
heal
heal, yeah,
for a really long time. And I mean, I'm 5 years out and I still have things change in
yeah.
good ways, in positive ways. So yeah, keep going moment by moment.
Yeah,
Yeah, thank you, Candy.
yeah, thank you very much. Lovely speaking to you.
Lovely speaking to you. Thank you to our listeners. We hope you enjoyed this hour with us. We'll look forward to seeing you next week. Thank you very much. Bye
Thank
bye.
you.